Have you or anyone you know ever experienced chronic pain? If yes, then you know just how painful it can be and how hard it is to deal with. Chronic pain is just one of many diseases that Botox can treat and potentially cure. Botox is usually associated with old ladies and wrinkles and saggy skin. And although there's a lot of scientific knowledge behind it, there are 3 basic things to understand. The first thing to understand is how Botox works. In an article titled, How Botox is Used to Treat Chronic Pain, Dr. Ko defines Botox as a pure protein extracted from botulinum bacteria and mixed with saline. The botulinum bacteria looks like this. Dr. Ko also states that botulinum and saline should not be mixed prior to 4 hours before the injection. Botox is injected with a syringe into the surrounding areas of chronic pain. It is typically administered with a syringe about this size. Dr. Ko explains that once in the muscle, the botulinum toxin sticks to the nerve endings. In an article named Botulinum Toxins, it is further explained that the Botox paralyzes the nerve endings, preventing further contractions. Contractions are what causes the muscle pain. This treatment typically lasts 2 to 3 months, but can be repeated for longer results. There are numerous types of Botox and numerous places people can have it administered, but the most common places people have it are their head, neck, face, and back. The effectiveness depends on the location of the pain, how long the pain has been persisting, and the severity of the pain. Understanding how Botox works is only part of it. Knowing when to get Botox administered is imperative to its effectiveness. Botox should never be the first treatment tried on a patient with chronic pain. The majority of people who experience chronic pain respond to normal treatments, like medication and physical therapy. A patient who is experiencing chronic pain should wait at least 3 months before considering Botox as a treatment. Also, all other muscular diseases should be ruled out before deciding on Botox. If a patient were to have another muscular disease and injected Botox into the surrounding muscles, many potential problems could occur. When also depends on where. Clinical trials by Dr. Ko showed that the most effective areas to have Botox administered for pain control is in the head, face, and back. If a patient is experiencing pain in the face or head, they need to make sure they try everything before resorting to Botox. The pain experienced in the face and head is the pain that is most typically treated well with medication or lifestyle changes. Because many people are unaware that Botox is used for pain management, they assume that it's bad and ineffective. Many people don't know because it's new, and many patients opt out of using Botox because they are scared, because they don't know anything about it. The risks associated with Botox vary depending on location, but mostly carry on from place to place. Contrary to popular belief, there are very few associated risks with Botox. An article named Botox Injections states that the main risks for Botox are swelling and bruising around the injection site, numbness, droopiness, or loss of bladder control. This is swelling or bruising around the injection site. Pregnant women should never opt to do Botox for pain management because there's a lack of studies that prove that there is no damage to the fetus. In my class survey, I concluded that 75% of our class would not try Botox as a treatment for their pain. Also, in another question on my survey, 75% of our class responded saying that they felt Botox was more dangerous than the typical treatments for chronic pain, such as medications, surgery, and physical therapy, which is not true. The risks could further be explained by a physician if a patient decides to use Botox as their treatment. In conclusion, most people associate Botox with cosmetic procedures, which means they don't take it seriously and aren't interested in knowing more about it. Once a patient understands how Botox works, when they should have it administered, and the risks associated with it, it can be a very helpful tool. Botox can provide new treatment options for people who have exhausted all other options.